As a child, did your parents or guardians ever tell you to wear slippers or sandals whenever you went outside? Or the moment you play with soil in your backyard, they will scold you and tell you it's dirty? Well, the adults were right after all. The purpose of wearing slippers and avoiding contact with soil in your backyard is to avoid soil-transmitted parasitic worms known as helminths. Examples of this are roundworms, whipworms and hookworms. Heavy infections can cause abdominal pain, diarrhea, blood and protein loss, rectal prolapse, and physical and cognitive growth retardation. Such parasitic worms are called NTDs, or neglected tropical diseases. However, in this time of pandemic, where COVID-19 is the main priority for most, the majority of campaigns and programs to help eradicate NTDs have been halted due to the health and safety protocols established by the WHO, World Health Organization, and the local government. So, what exactly are these NTDs, and what can we do to combat these dreadful parasites ourselves? Because soil-transmitted helminthiasis (STH) have already been mentioned, we will have to concentrate on the other parasitic NTDs that are the most prevalent in the Philippines. Schistosomiasis, a parasitic flatworm disease. Infection occurs when your skin comes into contact by urinating and defecating in contaminated freshwater containing schistosome-carrying snails. Symptoms such as fever, chills, coughing, and muscle aches may appear within 1-2 months of infection. To prevent this is to avoid swimming in freshwater, drink purified water, use proper sanitary toilets, and educate other people of the risks of this disease. Next is lymphatic filariasis, also known as elephantiasis. The disease is caused by parasites that are transmitted from person to person by female mosquitoes. The presence of parasites in lymph nodes causes swelling and hardening of the limbs and parts of the body. For prevention, the first step is to avoid going outside at dusk or dawn, when the mosquitoes that transmit filariasis are most active. Second is wear long-sleeved tops and covered pants at all times. Have a habit to always sleep under a mosquito net and apply mosquito repellent on skin. There are also food and waterborne diseases, or FWBD, that are caused by bacteria, parasites, and viruses. They are most common during the rainy season and are most common in areas with poor sanitation. Ways on how to avoid this is to drink only boiled and filtered water, store water in a clean container, thoroughly wash raw food, and always check to see if the meat, chicken, fish, and eggs are fully cooked. If infected, you may experience symptoms such as abdominal pain, nausea, vomiting, diarrhea, and dehydration. If you are infected with the following diseases, you must go to the nearest hospital or health centers and have a consultation with your local medical practitioners. Stay safe and always wear a mask.